I'm Danny Deloach, and I live in Hollister, Florida. Been here 42 years. Well, I've shoot horses for 60 years. I roped calves when I was younger, rodeoed, and now I've roped steers, or team roped, been all over the country. I was in the hospital with the COVID. I got pretty sick, and my wife, she carried me to Orange Park to start with, and I was running a fever of 103.8 whenever my wife came and picked me up, and she had to bring oxygen with her because I couldn't hardly breathe. Came home and told my wife that I need to spend the night home and just stay home overnight. She said, no, you got to go back to the hospital. So they determined that had I not gone back to the hospital, that I would have died that night. I was on a ventilator for 14 days, and then came off the ventilator. They said I probably wouldn't live through the ventilator, but I did. I was in the hospital, intensive care for 47 days. And during that period of time, I basically became atrophied so that I was about paralyzed.
We knew and understood during, the COVID times that we were in, why the family was adamant to bring him home versus going into a facility to try to further his recovery.
When I first met Mr. Danny Deloach, he was in a wheelchair and he actually couldn't get up. For some reason, I had a feeling that this person would be really working hard for me. And
so he worked on me and got me back where I could walk and kept moving around, and then the speech therapist got me so that I could swallow again.
Before COVID, he was still working, as a farrier, and that was my end goal, for him to get back to that level. He had the leg of the horse in between his knees. He was cleaning them up, he was riding them, he was getting up in there. Of course, I was scared.
Had Xavier not come to the house here, I would probably still be in worse shape than I was when I started. Xavier really pushed me to improve myself and to get better. And I think he'll vouch for the fact that I had the desire to do it and to get better. And
I think Mr. Danny is a testament that as long as you have the will to get back to your previous level of function and then some, and then even better, you get there.
Our ability is to be able to adjust and help them to achieve those goals, whatever they might be.
I feel so blessed given the opportunity to become a home health physical therapist for Brooks, because I'm given the opportunity to help my patients here at their own home, their own residence, and to have these results. It means a lot to me.
I've had a really good life, and I was able to continue having a good life because Brooks came and helped me.